Ultherapy is a procedure we've been doing for a little over 6 months. We have the second largest experience in the country now. And it's really revolutionary. We've been excited about it. It's non-invasive and non-surgical, and it really allows us to treat a whole segment of patients that we really didn't have really good treatments for prior. It's really been helpful for two kinds of patients. One is the quite young patient, the patient who comes into my office, 40 years old and wants a facelift. Clearly they don't need a facelift, but they do have some early aging. Maybe they're 45, some early jowling, some early laxity in the neck. And for those folks, this has been really a really excellent treatment. One treatment is all it takes, and they get nice results, and it's in and out, and it's been good. The second category of patients we found helpful is patients who've already had facelifts and other procedures, but they would like just to have a little tune-up or a little touch-up, and for those patients also a little touch-up in the neck or jowls or a little mini brow lift. It's been useful. The reason we like the treatment so much is that it's works with ultrasound. We all know ultrasound is used for everything from diagnosing babies to other kinds of benign tumors. And basically it goes through the skin without damaging the skin at all, but then it focuses deeper. We have two settings that are both quite deep, 4.5 millimeters and 3 millimeters. What that means is we can tighten the deeper layers where it focuses, and it really allows us to get some long-lasting tightening. The individuals did the early studies to get it FDA approved, were done mainly in the brow, and they noticed relatively long-term results of about 6.5 millimeters in brow elevation, which is really quite significant. So it's excellent in that way. Another thing that we really like about it is it allows us to really see with the ultrasound machine where we're treating. We can see bone, we can see the soft tissue, we can actually see deep wrinkles and focus on those. So we can kind of vary our treatment and tailor our treatment to the specific areas of the face because we're seeing what we're treating, and there's no other technology that does that. I've worked with, I think, the majority of the other skin tightening non-invasive procedures, and this one is, at least in our hands, far and above better than the rest. The patients like it because it's one treatment. The patients like it because results are fairly immediate initially, but then they get better for about 3 or so months. So all in all, we've found it extremely useful for the younger patients who don't need a surgical procedure yet, but want some rejuvenation, and for the older patients who've had some procedures and need a little touch-up. So we're still evolving with it. It was initially approved just for the face, and that's of course where we use it primarily. We've now found it useful for the back of the arms, buttocks, chest, and other areas of the body for skin tightening. So I think as we get more experience with this technology, we're going to find it's really very versatile and useful.